Now is the time to talk about stroke awareness. Chances are you or someone you know has had a stroke. We all hear what the risk factors are, but really how often are you checking to see if it relates to you? Dr. Christopher Southwood is here to talk more about that and also why more younger people are having stroke. Thank you so much for stopping by.
Thank you for having me.
So we were talking about the risk factors, and I asked you, how many people are actually keeping up to date with some of those? What are they first?
So a lot of the big risk factors for stroke are patients who have high blood pressure, which we call hypertension, diabetes, and high cholesterol. And one of the ones that we see commonly that often gets put under the rug is also smoking, and even what we're learning with vaping can increase the risk for blood vessel inflammation and stroke.
So clearly if you vape or you smoke, you know that. But if you have hypertension or diabetes or cholesterol issues, you need to get those numbers checked.
Absolutely. I think having a primary care doctor to be your first go-to and be screened, and of course even checking on those high blood pressure cuffs even in the store and the pharmacy is a good way to check for yourself to see if you have elevated blood pressure levels.
Because when all of these things add up, that puts you at risk for having a stroke, and more younger people are experiencing that. That is shocking.
Absolutely, and that what we're seeing is because either increased sedentary lifestyle from remote working, less exercise, any sort of pro-inflammatory state can cause it, and then also just younger patients are being diagnosed with diabetes and high blood pressure and cholesterol, just like we said, and so that also puts them at risk.
Now, here's the deal: a lot of people have a stroke and they go on, they recover, and you sometimes don't even know that they had that event. Can you talk about the recovery process? Yeah.
So the recovery process, fortunately, stroke recovery, we have about 6 months to get to our peak recovery. But the most important part of the recovery is within the first 2 to 3 weeks, which is why it goes to even recognizing the stroke in the first place, because our first action is to come in immediately. But then it also allows us to work on the recovery side of things as well.
Yeah, seconds count when you're having a stroke. You got to get in immediately, and that's where this comes in handy. I love this. BEFAST. It stands for balance, eyes, face, arms, speech, and time. Know these things.
Yes, absolutely. Yep, and call 911. You want to make sure that you get there as fast as you can. If you call 911, we get a heads up that you're showing up, and we're ready to meet you there and help treat the stroke immediately.
So I know that you're relatively new to the infirmary health system. What would you say drew you to this field, though? Why this area? Yeah,
so I had one of my partners who came down here, and he said that a lot of people needed help, and that there was a lot of people, a lot of ways to help people, and that was one area that we knew that, again, there's a lot of good chance for recovery and to reverse the signs of stroke and have people live a normal life. And so that was really exciting to be able to help establish the program and grow the program to where now we're at, we finished our comprehensive stroke center survey to be the only Joint Commission survey approved center in the region. So that's also very exciting.
That is awesome, something to be proud of. As we're wrapping up, we're out of time. Is there anything else you want to add to make sure that this message, drives home?
I think, as you said, time is of the utmost importance. We need to recognize a stroke. If there's any one-sided weakness, numbness, speech problems, vision changes, slurred speech, problems getting words out, this call 911, come into the hospital right away.
Thank you so much for stopping by and for helping to make a difference in the community.
Yes, thank you.